Tonight, Dr. Vaishali Kent is joining us to talk to us a little bit about breast cancer in men, but also women as well. She is a breast surgical oncologist with Baylor Scott White. So welcome. Thanks for being here.
Thank you for having me.
Yeah, so the simple right off the top, we know breast cancer cases in guys are rare, and I think I have that right?
Yeah, absolutely.
But they're out there.
Yeah.
So they are out there. Is there any kind of average age that a man is more likely to be diagnosed, just based on what the medical world has seen so far?
Yeah, well, first of all, it's very rare. If you look at women, 1 in 8 women will develop breast cancer in their lifetime compared to 1 in 800 in men. Average age, if a man is going to get breast cancer, is between 60 and 70 years old.
Right, and typically, like on the female side, there's we'll talk a little bit later about family history, right? There's that.
Yeah.
Is the medical world seeing something like that similar on the men's side, or don't know yet?
Well, in male breast cancer, because it's so rare, if someone's diagnosed, we want to see if they have some sort of genetic mutation making them predisposed to getting breast cancer.
Okay. The American Cancer Society says more than, I'm going to get the number right, 321,000 new cases of breast cancer are going to be diagnosed in women this year alone, 2026. I think I've heard with my wife of 32 years what should be done proactively for women nowadays, but what is the latest advice from you? If I'm your patient and I'm a woman sitting in your office, what are you going to tell me to do proactively?
The two most important things are keeping up with your screening mammograms and being familiar with your body and changes. So for most women, that means getting mammograms at the recommended age once a year, and maybe earlier if you have some risk factors. You also want to be aware of changes in your body. If you notice a lump, skin changes, or something that just doesn't seem normal for you, you should report it to your doctor right away for an evaluation.
So the lump is the one thing that we all go, okay, bingo, I got to go to the doctor, right? But you mentioned skin changes. What do you mean by that?
So sometimes you can have some redness or thickening, or you see some pores that you don't normally see.
Doesn't look right.
Doesn't look right. That needs to go to your doctor to be evaluated and make sure that there is nothing dangerous going on.
So just to play that out for half a second, if I see that, my first thought is, I need to go to the dermatologist. I wouldn't think my heart doctor or my oncologist per se.
Well, most physicians are well versed in looking at something and being able to figure out, okay, maybe a dermatologist looks at that and says, the most common thing this may be is an infection, but I'm going to keep in the back of my mind this is a breast and it could be a rare form of breast cancer. So I am going to work up the common problem, and if that turns out to be wrong, I'm going to keep in mind that this could be a breast cancer and refer this to a breast specialist.
Okay, I appreciate you going on the tangent with me for half a second.
Absolutely.
Are there certain women out there who should be more proactive getting screened earlier? I would think family history is the first and obvious point, but what else?
So there are women that are considered at high risk for breast cancer, and those women need to be screened earlier and may need something called supplemental imaging, which is just additional imaging to the regular annual mammogram. So if you have a strong family history of breast cancer, if you have certain genetic predispositions, maybe you were exposed to radiation for treatment early in your life in childhood, then you may be at higher risk of developing breast cancer. So you need to share your personal medical history as well as your family medical history with your physician so that they can tailor a screening plan specific for you.
So it sounds like even medical history from 20, 25 years ago that we may not even give a second thought anymore could be important in terms of current day diagnosis.
Absolutely. There are some treatments that were done in children at a young age that could make you at higher risk of developing breast cancer.
Really?
And if you are not aware of that as a physician, then you might not be recommending the appropriate screening.
Yeah, I think us as patients, and I speak just in a general sense, you know, we don't always go down the rabbit hole of truly everything we've been through to offer to our doctor, right?
We want to know everything. We want to know from day one everything about you so that we can come up with the right treatment plan for you.
Helps you make a much wiser decision.
Absolutely.
Course of treatment. The lump itself, does finding a lump always mean cancer? Because I think finding one would strike fear immediately in anybody.
Right.
Then we go down the Google rabbit hole, which is the worst thing on the planet, and I'm sure you would tell every patient that. But it doesn't always mean cancer.
Right, and it's not always bad to look up and try to figure out what's going on with your body. And most of the times, a lump can be a benign mass or a cyst, especially in young women. But that being said, any new lump in the breast needs to be evaluated. We're not trying to create fear, we're trying to promote action. If a lump is evaluated and we see that it's a benign mass, then we can reassure a patient there's nothing wrong. But if it's something more serious, then we can initiate treatment early.
And a lump, one of the last two questions, a lump can be found, male or female, in any part of the breast? breast, or does it show up in one particular area?
Any
usually?
part of the breast.
Okay.
So when you are examining yourself, you should check all parts of your breast.
Okay. All right. What do you want viewers watching here or later, when we post this online on our YouTube page, what do you want them to know when it comes to breast cancer? You kind of get the stage. Give me your best doctor advice here.
Breast cancer is scary, and the idea of having breast cancer is scary, but we are finding breast cancers earlier and treating them more effectively than ever before. I think the important thing is to stay proactive about your health. Don't delay your screening mammograms. Don't delay reporting changes to your doctor, and don't be afraid to ask questions. Reporting these things to your doctor can make all the difference in the world.
Yeah, and the tough thing, and we've been down the path with women in my life, sometimes it's the strongest women who wait the longest to go look for help.
Right.
Which is not the right thing to do.
That's correct.
Yeah, Dr. Kent, thanks for being here. We appreciate you.
Thank you for having me.
Dr. Kent's from Baylor Scott White, and you can watch all of our Eye and Health segments, this one as well, right now on the CBS Texas YouTube page. We appreciate you being here tonight.